websites because they're really helpful, and they're definitely going to be helpful when you are doing your projects. So we're going to go over them together. All right, so the first one we're going to look at is the Center for Medicare and Medicaid Service. So they, otherwise known as CMS, all right, so Centers for Medicare and Medicaid Service, CMS, and you could look at, type in quality improvement, okay? All right. So here on cms.gov, it talks about quality improvement organizations and the different types of projects that they're doing. So the Quality Improvement Organization Program, it's one of the largest programs dedicated to improving quality for Medicare beneficiaries. And here's the thing. So you might be thinking, okay, Denise, well, Medicare beneficiaries, that's not all of our patients, but all insurance companies take a nod from CMS. So if CMS approves something, most likely an insurance company will. They will come up with different ideas, reports that go to Congress, and hold us accountable. So Innovation Center, if you look here. All right, so one innovation is happening. The CMS Innovation Center is a growing portfolio testing various payment and service delivery models that aim to achieve better care, smarter spending, and healthier communities. So let's see what models we have, okay? Okay, so there is the accountable care model, okay? This model allows provider groups to assume higher levels of financial risk and reward than are available under the current model. There's a model that partners with the CMS and states that offer Medicare shared savings program. And so these are testing models to provide better care, which is really interesting. And here's some research statistics and data systems, which, oh, it's not working right now, which is what we look at to compare to make sure that our outcomes are the same. Okay, so the next one that's really important is called the AHRQ, the Agency for Healthcare Research and Quality. Okay, so AHRQ is all about benchmarks, okay, and they use this in most outpatient and a lot of inpatient settings. So if you look under tools, you can look at education and training tools kits, hospital and health system toolkits, and how to improve certain ideas. So hospital guide to reducing Medicaid readmission. Okay, well, let's look here and see. So reducing readmissions is a national priority for payers, providers, and policymakers. This is all part of quality, all part of reporting. And so here you're going to see all these different tools on what you can use and different models of care. So let's see, introduction and overview, a webinar with slides and recordings that's going to discuss readmission and reduction efforts. So the Aspire, designing, delivering whole person transitional care. So how do we get somebody out of the hospital without without being readmitted so frequently? I'm just going to pull this up so you can see. The AHRQ is really cool quality improvement presentations that you can look at as well for your poster. Okay, so here is that webinar. And so if you were looking with your hospital, we want to decrease readmissions. So it describes, it sets an agenda, objectives on how to utilize resources, and steps on what to do next. I just think it's really helpful. Okay. Let me show you. So data, this is where we report to, and that's how they set benchmarks. So I'm going to show you state snapshots. All right, so say you want to compare your state. Okay, let's look at Ohio because that's where I live. Okay. All right, where are we? Okay, so we're average with patient safety, patient-centered care. We're really weak with care coordination, average with effective treatment, average with healthy living. Care affordability is average. So that's how we look at things and we try to improve based on a state. And you can actually look up even deeper based on your organization.